pressure-sensitive mat for a pre-selected amount of time. Because you are going for a CNA maybe, this is mainly for CNAs, vocabulary for LVN, LPN, and RN, and BSN might be different, but as for a CNA, your main thing is helping people that are in bed. And the bed alarm is an activation system, that warns you, the CNA, by setting out an alarm when a patient is trying to get up. They could be delirious. They could have just gone out of surgery. You remember the alternating pressure mattress where the patient, from a few videos ago, where the patient has to sit or lay down on a bed, and they have to remain that way, otherwise after surgery their joints and bones and everything won't connect properly. Well, this warns if they get out of bed or somebody delirious that could be potentially harmful. They're on a pressure-sensitive mat, and that will tell the nurse who's not in the room, it'll send a signal to them that they're actually getting out of bed, so the nurse can come and direct them back into bed and help them. A frame shaped like barrel, half lengthwise, that is used to keep bed linens off a part of the patient's body is a bed cradle. Okay? A frame shaped like a barrel cut in half, so like this. You know how a barrel looks? It's a U shape. That is used to keep bed linens off of a part of the patient's body. Say they have to look at the patient's body, or there's something's going on with the patient's body and nothing can interfere, they will use a bed cradle. And it's pretty self-explanatory. Like this one, bed bound, unable to get out of bed. And it's pretty self-explanatory. You're bound to the bed. It could be, since there's a hyphen, it could be you're strapped to the bed. You could be delirious and you might hurt somebody, or you could be a serial killer that got shot 20 times by the police and are still alive. So they strap you to the bed so you can't get out when you do eventually wake up after the surgery, because they help people, mass murderers do, in hospitals. Bedpan. It's basically that a portable toilet, a pan about this big. It's like a bowl but shaped like a toilet where you could just defecate or urinate inside of. It's for patients in bed that can't get up and go to the restroom because they're too sick, elderly, delirious, they wet themselves, something like that. The exact same definition for bedbound, where you're restrained, is bedridden. But it says the exact same words, unable to get out of bed. But bedridden is not bedbound where you're strapped to the bed. It is where you are too sick to get out of bed. You have an infection that you're too weak to get out of bed, you'll just collapse. You might be too delirious. You have dementia, you can't get out of bed by yourself. You have to have somebody there helping you, or you might not even be able to get out of bed. They may just keep you in the bed, and that's why you need things like the bedpan to defecate, urinate, all that, and wear a diaper and all that. Benign tumor. A tumor that stays at its site of origin and does not usually regrow once removed. So a tumor that's there, it's not going to move around, it's not going to spread. If you have arm tumor, it's not going to get in your bloodstream, it's not going to go to your head and cause brain cancer or anything like that. It's a tumor that is basically like a growth. Once off, you don't have to deal with it again. It's not going to come back. It's just a benign tumor. Benign sounds very very simple, very non-threatening. Benign. Well, that's a tumor that's not going to just keep coming back and keep coming back. And 10 months out of the hospital, oh no, sir, you have cancer again. This is just a tumor. Once it's gone, it's just a growth, a bunch of cells that just kept growing, they wouldn't stop. Once it's gone, you don't have to worry about it again. Bile. A substance manufactured by the liver that helps the food breakdown process. So it's basically one of the parts of the digestive system where it helps break down the food that you've eaten. It's bile. Sounds quite vile because it probably stinks, but it's bile. Substance manufactured by the liver, so it's from the liver, bile, liver, try and associate those, that helps the food breakdown process. Okay. So bile, liver, food process breaking down. So far, and once again, try and stop the video and see if you remember all of these words. I'll put them down below. And let me know if you also want me to put them on the video, like a little comment on the video. Tell me if that'll help. Maybe that could help, and it could help your learning process. Then you can click the button, take it off, and then click the button, see if you got it right, something like that. So artery, arthritis, asepsis, aseptic, aspirate, assessing, atrophic skin, atrophy, autoclave, autonomic nervous system, axillary, bacteria, bargaining, bed alarm, bed cradle, bed bound, bedpan, bedridden, benign tumor, and bile. Next video we'll continue on with the bees.